As a physician, I knew how bad the situation was. And at that point, I said to myself, oh, so this is how I'm going to die. My name is Edward Slaby. My wife and I grew up in Riverside, Illinois, near the Brookfield Zoo. Went to the high school next to the zoo.
Ed and I have known each other for a very long time. We went to grade school together. We dated in high school. We got married, and we've been married for 54 years.
I went to dental school first, and then I had a 4-year residency. And after my training, we moved to Kankakee in 1970. And immediately joined the staff at Riverside. I loved practice until I retired in 2012. After we became established in the community and my practice was under control, we got involved with Arabian horses. So the day of my accident in August of 2014, I was out riding right out here in front of the house with my granddaughter. She was 11 at the time. I was 71 years old, but I've been doing this for all of my life. I wasn't paying attention. The horse kind of lunged to one side. My foot slipped out of the stirrup and off I came. It knocked the wind out of me. For a few minutes I couldn't catch my breath, and I realized I had broken some ribs. I know that you can lacerate your spleen or your liver in a fall like that and be bleeding internally, so we went to the emergency department. At the emergency department at Riverside, they got me in immediately, of course, and did an assessment, did a CAT scan, and determined the good news was no organ laceration. The bad news was I had 5 broken ribs.
I actually saw him out of the corner of my eye in the emergency room that night and said, geez, maybe you ought to come in for a day or two oh no, I'll be fine, I'll take some pain pills. And well, anyway, he did go home that night, and then a few days later I was in the operating room and I got called, said that there was a patient that was coming in hemorrhagic shock. I got up one morning, my daughter was here visiting, and I was talking with her, and I got up and I walked down the hall to go to the restroom. I moved and I felt this crepitus where the bones rubbed, and immediately after that I noticed that I was crashing, is the term that we use. I was starting to get short of breath. I could feel my blood pressure probably, I was getting dizzy. And I sat down in the chair because I knew what was happening, and I called my wife over and I said, call the squad. I said, get a blood pressure cuff and put it on my arm and take a blood pressure, and get a paper and pencil and start writing down what I'm going to tell you, because I'm probably not going to be conscious when they get here.
I went over, I could see that he was in really bad shape, and I did a lot of praying right then.
So he'd been coming in through the emergency room in shock.
And I heard they called for the IV team, and I heard someone say, oh, it's Dr. Slaby, oh no.
Let's face it, Ed is kind of one of those celebrity local people. It's not that they deserve any different treatment than anybody else, but when we know these types of individuals, we have pause for a minute.
Then I heard someone said, we just got a call, Dr. Rowland's on his way. And I thought, Paul Rowland? This is too good. I mean, if I had to pick someone, Dr. Rowland would be at the top of the list.
When I heard that Dr. Rowland was coming, I was really happy too.
Barely able to breathe. I was gasping for air. I had oxygen on and so on, because my lung had pretty much collapsed at that point. I was helpless. I was completely in their hands.
He had been bleeding into the chest, and even though he had broken ribs before, now they'd been moved in different directions. And on the underside of the rib, there's an artery and there's a vein, and when that happened, the rib must have sliced through those blood vessels at that point.
He's such a great guy, and he has a very calm, reassuring manner about him. Everyone was really kind and was explaining everything that's happening. And of course I knew what's next. First they're going to do this, then they're going to do that, and so on, from my experience. But they were all reassuring and talking to me and so on. And then of course they transported me to the operating room. And then as I was moving onto the operating table, I thought, well, I know Paul's going to get my chest open really fast. I've seen how you do it, and he's going to get a clamp on those bleeders. And at that point, I thought, I guess I'm gonna survive. wow, I'm going to survive.
And it was really comforting to see that many people working so hard. And I thought, that's really wonderful. They're letting him know exactly, because he knows, he knows what's going on. But to have someone tell you that, I thought was really important.
What I remember is the feeling that I had in the emergency department. And it was really a good feeling. I saw in my blurry vision the nurse over that I think was the one that was talking in my ear. And I said, could you come over here? And she came over. And I said, thank you for what you were doing for me. And I just want to tell you what you did was so important to me.
Riverside has an excellent emergency room and an excellent staff that works there, the doctors, the nurses, the technicians. They all know their job. They know what to do. But this is a very unnerving thing for anybody, myself included, when a person like Dr. Slaby is coming in like that. And I knew that when I would come in, I was going to be the captain of the ship, and everybody would look to me for guidance and direction. So it was very important that I would remain calm. By doing so, then everybody can function professionally, they can do their own work. I think our community is really blessed to have such a continuity of different types of surgical capability here. The community has a fine neurosurgical program where they do spine surgery and head surgery. We have an excellent cardiovascular surgery program. I felt it was good enough that when I had my own open heart bypass surgery 5 years ago that I could have gone anywhere I wanted, and yet I chose to stay locally for that. Our latest project is working with robotic colon surgery. These are operations that used to bring people into the community and they would be in the hospital for 5 to 8 days. A number of these patients now are heading home in 1 or 2 nights, back to work, including major physical work within 1 to 2 weeks. So it really is going to be a big changing thing, and I'm quite proud to be the leader that's been tackling that problem locally.
How do you thank someone for saving your life? I mean, how do you do that? I have no idea. I've always made a contribution every year to Riverside Medical Center, Riverside Foundation. And when I got my notice in the mail last year, it said, you can do this in honor of somebody that did something special for you. And I thought, well, that's easy. I'm going to do this in honor of Paul Rowland. Of course, I'm also thankful to all the people that took care of me. So when I decided, rather than just put down his name, I'm going to write a letter describing my experience. So I wrote a little letter and I sent a copy to Paul, and I sent another copy along with my contribution. One of the things that Dr. Rowland has allowed me to do is to enjoy seeing my granddaughter achieve goals like this. And what I would like to say to Dr. Rowland is, once again, is thank you. I don't know what more I can do than that. The way I see it, he saved my life along with the other people in the emergency department that day, and it's been a good life since. And I look forward to more years, but thanks, Paul.
Ed, I think this is directed at you. I'm appreciative of the opportunity to care for you, but I've also seen how you've cared for our community for many, many years. Putting my kids in your hands was just important to me as you putting your care into my hands was to you at the point in time. I thank you so much for everything you've done locally. Not only have you been a great servant of our community, but you've also built a great practice with your partners at this point in time that have carried on after you've chosen to retire. I have one bit of advice for you: sell the darn horses.